Hi, and welcome to another episode of the Healing Lyme Summit 2.0. I'm your host, Dr. Mariah Hinchy, and today we're going to be talking about neuroinflammatory symptoms of Lyme disease and other vector borne illnesses. Here with me tonight to talk about this is Dr. Ebony Cornish. Dr. Cornish offers integrative medicine services to a global patient base. She specializes in functional medicine, neurological imbalances, brain imaging, autoimmune diseases, Lyme disease, environmental toxicity, genetic disorders, gut imbalances, chronic infections, and mold illness, among other chronic conditions. She employs a comprehensive approach to identify the root causes of health issues within the body's various biological systems. Dr. Cornish's treatment philosophy is both integrative and evidence based. At the Amen Clinics, she has played a pivotal role in developing the Neuroinflammatory Intensive Program, which is a 2-week inpatient program addressing neurological complications of Lyme disease and other chronic inflammatory conditions. Welcome, Dr. Cornish. Tell our listeners a little bit more about yourself and how you became involved in treating and specializing in the treatment of Lyme disease, as well as developing this very much needed program.
Thank you for that introduction. When you were talking, I was like, what don't I do? Right. So yeah, originally born in Detroit, Michigan. There are no ticks there, according to most, right? And went to Rhode Island. That's where I saw when I was at Brown. I went to undergrad and med school and I fell in love with what were called drug-seeking patients. And that means my landscapers and people who would come to their local clinic who had had EM rashes or still would have persistent joint pain and seek help with antibiotics and was told they were drug seeking by my attendings at that time. And then when I moved here to DC and went to residency at Georgetown, the same thing happened. And then it was like this job came up. I was doing primary care and I was bored. And Craigslist, a job came up that said for doctors who think outside the box. Like I was shopping for a couch, all right? And I'm like, I'm outside the box. Let me go. And so my life changed and I will never go back. And so when it comes to treating tick-borne illness, I've been doing this probably 14 years now. And I'll never forget my term was, we got to figure out the missing link. If we don't figure that out, we're in a world of trouble. And so when it comes to thinking about brain inflammation and things like that, I want to see it because the brain is one area you got to look. I want to know. And so many of these patients with tick-borne illnesses come back with these normal MRIs, these normal CT scans, normal everything. And so when I decided to come up with the idea for the program, it was like, look, I want to give you some loving for 2 weeks. I want to get your brain scanned. I want to treat you based on your test results, based on your brain scan. I want to get you on the best diet possible. And I want to make sure I just take care of you in an aggressive manner. And I love it. I mean, it's been working really well and collaborating with colleagues like you and others just to give that consultation and that intensive management that these patients deserve. And that's how I got into it. I wanted to do one that was realistic, comprehensive, and functional to help those suffering. Now, that's it. That's all I got.
That's awesome. So, for our listeners who are sitting here going, okay, what exactly is neuroinflammatory disease? Help the listeners understand what could this manifest as? What are common symptoms? And then also what disorders fall into this category?
All right, so let's break it down very simply. Inflammation is a fire, right? You know what fire looks like, and you try to put it out. Some people put oil on it by mistake, or they might put water. Neuroinflammation basically means your brain is on fire for whatever reason. And it can be due to infections, it can be due to environmental toxins, it can be just due to lifestyle and diet. And so basically, what happens is, let's talk about some of the disorders. One of my favorites that you are very into the field is autoimmune psychiatric associated with strep throat and other infections. Boom, they change overnight. Personality changes. You have psychiatric symptoms. You have chronic fatigue, OCD, and someone who's completely normal. So even with Lyme disease, you can see that same change. You can see cognitive impairment. You can see, mood instability, just changes neurologically, chronic fatigue. You see that with environmental toxins like mold and heavy metals. Some people are too sensitive and those changes occur. And then also you think about those diseases that we're aware of, like Parkinson's and ALS and multiple sclerosis, but keeping in mind that I've seen patients who are diagnosed with some of those conditions and actually have an underlying trigger like vector-borne disease causing it. So just always remember, it's brain on fire, something changing, as little as chronic fatigue to as big as MS, ALS, or Parkinson's.
Okay. So, how does an infection like Lyme or other vector borne diseases cause neuroinflammation?
So the one thing we know is that these bugs are smart. These vector-borne illnesses, they are brilliant. And they have the ability to cross into what's called our blood-brain barrier. And not only do they do that, Mariah, they get so fancy that they're going to say, okay, I'm smarter than this brain. I'm going to cause your immune system to start fighting off your nerve cells. And so it's like party time. It's like inflammation everywhere. And then you get that thing called an autoimmune neurological process that occurs because these bugs have crossed the blood-brain barrier. And then you get all kind of things that are released, like, cytokines, which is a fancy word for just inflammation, right? And it becomes a mess. So it becomes this big fire. These bugs are in places where they don't belong. And then you're suffering from things like mood instability. Oh, my mom was so nice. Like, I'll never forget. I had this old lady. She was the nicest lady. She was 83. And I was like, oh, she is so sweet. The next minute, she threw like my papers, pens down out of nowhere, like this cute little lady in the lobby. And her husband was like, look, she's had Lyme disease for 15 years. And her personality has been like this for the last 2 years. And that's called Lyme rage. So those are just different kind of presentations you can see. You can see psychiatric, you can see cognitive, but don't be afraid to look for it if something has changed with your brain. It's that simple.
Right. And especially if it's like an acute onset as well. Like I think that's a really big red flag, especially in adults. Like if you have this change in personality,
Yeah.
but and even with kids, like an abrupt onset of some sort of neuropsychiatric symptom.
And another key thing is that it doesn't respond to other things.
Right.
You're taking all these psych meds and benzos and sleep meds and still isn't working because you can't treat an underlying infectious process with an antidepressant, a stimulant, or any of those other supportive medications. You got to find out the root cause. And that's really what I see a lot in my patient population. They've tried all the psych meds. They tried all the neurological meds. They've tried it all the MS meds. And it's really when you get to the root cause that they start seeing some changes.
Yeah, exactly. So, generally speaking, what is your approach to healing patients from these conditions? Like, what are your main principles or the main bases that you're trying to cover?
Now, I always make sure I cover the basics because so many people think when you go see a Lyme specialist, because I consider myself a generalist because I'm also looking at everything else. I
Hmm.
always make sure hormones are stable, someone is sleeping, and someone is eating right. So many doctors jump to trying to treat the problem without setting the stage. So I always tell patients this is boot camp in the beginning. I got to make sure that your gut is stable so these things I give you will be absorbed in your body and not in the toilet, right? Because if you have
Mhm.
leaky gut, you're going to get minimal absorption of those nutrients and medications that you want to work. I also work on sleep with natural remedies or making sure mood is stable, with either colleagues or giving them easy things like 5-HTP or L-theanine, things to like calm them. And that kind of gets me started. And then I might, if I need to, do some diagnostic testing so that I understand the root cause, I understand the environment, and I make always realistic expectations. I never go in a room and say gluten-free, dye-free, serve. No, I find out where they are because I know if a person's eating McDonald's every day and they're showing up to my office with chronic vector-borne illness and they're not sleeping, I have to find out, okay, what can you give up? What's one thing that you think your brain doesn't like that you can give up? And it might be that one thing, maybe that McDonald's French fry that we work on. And every week start, making it so that we titrate slowly. So I feel like if anyone is in this field treating these complex, critical, inflammatory conditions, that you have to set the stage for success. I also, in a lot of my severe patients, I have found that SPECT brain scan imaging is crucial because it allows for me to determine what actually is going on in the brain. And then when I get down to the bottom line, I have a good plan, got my data, start my treatments, but I'm already preparing you for success. But more importantly, figuring out what may prevent this from working.
Right, right.
So, yeah.
So tell our listeners more about a SPEC scan. What does it show? What is it evaluating? And how does it guide you in your treatment?
Ooh, I love SPECT scans because, like, with the brain, and everyone's heard doctors talk about neuroinflammation, right? You hear that term just like today, but you need to actually look for it. And SPECT scan, which stands for single proton emissions computed tomography, actually does that. It looks at anatomy, it looks at what areas of the brain are not working well, it looks at what areas of the brain are working too much. It also rules out things with patients like traumatic brain injury or sleep apnea or ADHD or trauma. But more importantly, it gives me a clue of if this patient even is still inflamed from a neurological standpoint, because it tells me what questions to ask. And when I first started working and collaborating with the AMIC clinics, when I was working in private practice, it was because the psychiatrist would send referrals for patients who had abnormal brain scan. They're like, oh no, this is not depression, this is something else. And so I was that detective who would look at the brain imaging and try to also figure out what else was going on. And of course, it would be vector-borne illnesses or mold or heavy metals or, even sleep apnea. So it's really good. So not only do I get to rule in things, I also get to rule out things because there are sometimes patients who present with those neuroinflammatory symptoms and their SPECT scan has symptoms of just traumatic brain injury or trauma or prefrontal dementia, something else that might be going on outside of a pattern that's consistent with infection or toxins. So I feel like it's critical for my patients, if they can do them, to have them. I love collaborating with colleagues like you, looking at the brain itself, because you can determine not only what's going on, but what therapeutic methods can be helpful. Because guess what? We talk about mast cell activation a lot. We talk about basal ganglion encephalitis. We talk about all these things, but are we looking at it in the brain? And when you take a peek and then you treat a person and you might see, oh my God, they're herpsing, or oh my God, they're in a big flare, and you visually see that, it's so rewarding for you and for the patient and their family because you really know what you're doing. All right. And you really know if you're going in the right direction.
Right. And then it's got to be pretty amazing too, especially like as a patient sitting there to be able to look at your scan before and after treatment and see, that you've resolved a lot of that neuroinflammation and that your brain is looking more functional, right? More normal.
Exactly.
So,
Exactly.
obviously, the SPEC scans are a big part of the 2 week intensive program, correct?
Yes.
Okay. So, what else would a patient expect to experience during this 2 week program?
So before they travel, because it is in Reston, Virginia, so it's residential, they stay in our area for 2 weeks.
Hmm.
They would expect to meet with a nutritionist because where they'll be staying has a kitchen. So they'll get a shopping list and all the things that help them heal their gut. They'll also have 2 exams per week with me,
Hmm.
doing comprehensive testing, reviewing their spec scan, following up after treatments, and then they'll get anywhere from 3 to 4 different types of IV agents. May that be antibiotics for those who have severe neurological Lyme or vector-borne diseases, or things like NAD or B12 or glutathione or Myers cocktail or alpha lipoic acid, vitamin D, whatever that patient needs. We try to make it an individualized approach. So
Okay.
whatever that patient needs, we try to make it an individualized approach. And then we have the ability to add on things like hyperbaric oxygen, which can increase blood flow, but at higher levels can be antimicrobial. So it's just looking at the entire patient, because it's not like I can tell a scan and say, oh, you have Lyme disease from your brain scan. No, I can say, ooh, this is significant inflammation. And this part of your brain here, what's called the top, the parietal lobe, it's not well. And so that could be toxicity or infection. And then we work on strengthening other parts as well. So it's really cool. I have a lot of fun. We've had some great success stories, of people coming in, frankly, psychotic, going back, verbal, patients coming in never tolerated any oral treatments, had severe Bartonella, came back out, being able to go back into her work environment. So it's never a cure. Some patients are from programs say, oh, we're going to cure you. I call this a
Not in 2 weeks.
jump start, not in 2 weeks. We're gonna, and some of my friends will send my patients like, hey, make sure they're compliant. At least they'll be compliant for 2
Right.
weeks. But it is great. I'm really excited about it. I
I
call
know
it
you
my
are. And you're
baby.
so passionate about what you do. And I'm so excited for you to be, launching this.
Thank you so much. And I'm so happy to have people like you out here in the trenches doing what we do and supporting each other. I'm very happy to have that. It's a blessing.
Yeah, it is. So, Dr. Cornish, where do you think most treatments go wrong?
I think it's when, just like in primary care, when you jump to trying to treat something without looking at the big picture, like we talked about earlier. So many of my patients, because I see kind of like some of the sicker of the sick, been referred and seen at least 3 doctors before they come to my office. And the number one reason they fail is because the doctors didn't look at the big picture, just had that monolithic approach that, oh, this is either Lyme, or if it was a mold patient, it's only low mold, or if it's a pandas patient, it's only this. And the person sitting here, not sleeping, anxious, gut is awful, like that McDonald's example. That was a person who had seen numerous other doctors, right? And
Yeah.
so they just jump and just do antibiotics. And that's it, kill, 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 and then give supportive meds. If you got pain, I'll give you a narcotic. If you got this, I'm going to give you this, but not looking at the big picture. I also find that environment has a lot to do with it. And I mean, it takes time to look and try to treat every part of the human body. But look, missing that environment, missing that mold, that water damaged building, missing that, toxic metal. That's critical. And that's another reason why a lot of people fail, because someone is not looking at environmental causes. And then another reason is they might not have the right thing.
Yeah.
They might be missing the right, diagnoses. They might be missing the right bug. They didn't factor in what COVID could do, or they're not treating yeast or viruses or the right vector-borne disease. And that happens. No one knows everything in this field. Nobody. So
Right.
those are the real reasons why I've seen failure, and what I've personally learned from through the years. When I first started, it was all about just treating vector-borne disease. Well, we just called it only Lyme. We didn't think about inflammation. There was no detox. It was kill, kill, kill all the bugs in the body forever. But then I realized that didn't work. That's not it. You got to look at the big picture. And that's why people fail. And the last thing that I think about is when people go too aggressively in these very sensitive patients, these patients who have limbic system problems where they're in fight or flight, or they have mast cell issues, and someone's pushing all these drugs on them, even if they're herbals, like, oh yeah, you better take it, it's going to work. So not paying attention to what the patient is saying in their body. That's another reason.
Yeah. Yeah. I think it definitely, the focus needs to be on healing the patient, not killing the infection for sure. So, what would you say is the most fascinating presentation of chronic Lyme or other vector borne diseases that you've seen?
Oh my God, you put me on the spot. Ugh. So I would say probably my patients who've been dismissed the most, because we see patients who've seen 3 or 4 doctors before they come to our office, right? But my most rewarding patients are those who suffer from Morgellons disease. And it's fascinating because these are patients who've been dismissed by numerous doctors, their families. They present with these non-healing ulcers on different areas in their body, which are wounds that don't heal. And then they have this collagen fiber excretion from these wounds that are black or red in color. And, people think they're nuts. People think they're crazy. And its official diagnosis that was provided was delusions of parasitosis. And they think they're delusional. And a lot of times they put on antipsychotic medications and the like. But my first patient with Morgellons was a Lyme patient. I had no idea what Morgellons was. She taught me about it. I was blown away. And Charles E. Holman Foundation, it's like a support organization for Morgellons patients. But I always tell doctors, because I trained on Morgellons, you treat it like you treat tick-borne disease. You
Hmm.
find out what that underlying infection is, and I guarantee that those symptoms will get better. And it blows my mind. And sometimes I'm even tearful behind closed doors when I see great results. I had one Morgellons patient. She told me she was diagnosed with leprosy. Wounds were everywhere. And now she has a 3-year-old baby. And I mean, it's just like stories like that. It's too many to even think about. But that is the most fascinating part of these vector-borne diseases, that they can have this dermatologic manifestation.
Yeah. So, have you had a Morgellons patient that did not turn out to have an underlying vector borne disease? Have you seen causes outside of it?
I have, and let me tell you something. The one I saw, this person, I call it the M&Ms. I call it Morgellons, mold, and mast cell activation and multiple infections. So I guess
Yeah.
that's the M4.
Yeah.
But I saw a patient who had H. pylori and also had Morgellons.
Okay.
But the literature, because I try to keep things evidence-based,
Yeah.
was based on cows, and it was called bovine digital digitalis. And they found in the hoof of these cows that they were excreting these filaments from these wounds. And this was researched by Ray Stricker and Ginger Savely. And
Hmm.
so typically we want to use evidence as we justify the nature of this disease. But clinically, I have seen H. pylori in some cases. I have seen biotoxin illness be remediated in some cases. but a lot of times there's an underlying infection. And the one misconception is that a lot of my patients think they have parasites coming out their skin and they're going to infect their families and these are living things. No, they're derivatives of collagen. If it
Yeah.
qualifies as Magellans, you have to see those fibers under microscopy. You can't just say, oh yeah, I got this. No, you need to diagnose and treat. So I would say I keep it evidence-based, but anecdotally I've seen a few other causes.
Yeah, it's devastating. I've had a couple handfuls of Morgellons patients, and almost every single one of them has been told that they're delusional, that it's all in their head. And I've had patients who are very afraid of infecting their families. They've also been alienated by their families, by their coworkers. And it's so isolating. But if you can get to and treat and correct and heal that underlying cause, they will get better,
Yeah.
and it's amazing.
Yeah. Always about finding that root cause. And especially with my Morgellons population, I'm even more aggressive than other populations about gut health and diet. I'm like absolutely no sugar, no gluten, no dairy, because we know you have a neurological manifestation of whatever your diagnosis is. And on top of this, that dermatologic manifestation of a chronic infectious process. So we got to go aggressively. And you know what? Sometimes that starts to turn that cycle around and then treating the gut, checking for toxins, treating the underlying infection. It goes a long, long way. And like you said, it's so rewarding when people get better, but it does take time. And that's the challenge. It's not
It
one of
does.
those not anything we treat is
Yeah,
miraculous, right? But it definitely, those are some of my more challenging patients, but I love it.
good. So if any of our listeners want to be a patient, how would they get a hold of you? How do they find you? Let them
Yeah,
know.
so they can reach me on at www.amenclinic.com. I'm in the Reston office, which is also called Amen Clinic DC. We also have a link on that page to our neuroinflammatory intensive program, or they can call my office and, say they heard me on this podcast at 703-880-4000 and just say, hey, we heard Dr. Cornish. We want a consult for functional medicine or tick-borne diseases and go from there. So, and then I'm also on social media. I'm on Instagram at dr.dr.ebonycornish and at TikTok now, trying to get cool at
Nice.
Dr. Ebony Cornish, DREBONI Cornish, one word.
Awesome. And I know you have a lot of speaking engagements coming up. So, in addition to that, do you have any special events that you would like to share?
Oh gosh, yeah. I'm always running my mouth somewhere. But I'm always because I'm passionate about it. I gotta get the
Same.
word out, If you invite me, I'm gonna say yes. My poor triplets, they'll say, what's mommy doing in her office again? But I'm doing the I'm doing the Gaslit Truth podcast. I'm also doing the IHS for Integrative Health Care Symposium
Mhm.
podcast. I'm doing a podcast with Gabby Chung in Australia. All of these will take place in December and January. I'm also going to be speaking at IHS in New York, and that's in February. MedMaps, which is one of my favorite organizations for pediatric patients and physicians, and that'll be in March. And then who knows? I'll be somewhere else.
Well, thank you for sharing and thank you for being here with us tonight.
I'm
It's
so
been an absolute pleasure as always.
I'm so happy you invited me. And whenever you call, I will answer and I will always say yes. I will do my best. I hope you do the same when it comes to babysitting these triplets.
Drop them off. They can entertain my one.
Hey, I got quads now, so bring them
Oh
over
my
too.
goodness. So
But
funny.
yeah, so
All
that
right.
and
Well,
and we're adding a dog. I should have said that's another one of my
ooh,
hobbies.
all right.
Yeah.
Well, you've got your hands full as usual. All right, Dr. Cornish, thank you so much. And to all of our listeners at home, thank you for joining us. We look forward to seeing you at another episode of Healing Lyme. Have a great night.